It feels like shards of glass down there. It hurts so bad that I can't even wear jeans anymore. It's so red, angry, and inflamed that when I wipe myself with tissue, it bleeds and burns. Intimacy? What intimacy? I haven't been able to have intimacy in so long. If those sound like things that you feel or have said, then this is probably a video for you. If you enjoy content that's geared towards the more mature woman, beauty, skincare, and lifestyle issues, and real talk sometimes, then consider hitting that subscribe button. We cover a lot of topics like this on this channel. So I'm Mona. I'm almost 54 years old. I've been in menopause since I was 40. And I started experiencing vaginal atrophy around the age of 45. I didn't know what it was. I just knew that it was uncomfortable, it was getting tender, and it was starting to hurt. And that's not a conversation that you have with a lot of people. I had brought it up to my doctor. My gynecologist kind of blew it off as well, just get some lubrication over the counter. And I did, but I knew that that wasn't helping me. And so I suffered in silence for a while longer. And even though I brought it back up to my gynecologist and my primary care doctor, it was women like my mom and relatives and other friends who actually really helped me get to the bottom of what was going on with my body. And even though I'm a registered nurse and know a lot about the anatomy of a female, that's just a conversation that we don't want to think about or talk about too much. So the fact that I had to get my information from other women rather than my medical doctors says a lot about healthcare in the United States and probably in other places today. And it's why conversations like this between us women, even though they're uncomfortable and sometimes they seem awkward, they're important to have. And so I'm hoping that you will join the conversation today. This is part 1 in a series on vaginal atrophy, or what is now referred to as genitourinary syndrome of menopause, which I think is a better name. I think that together we can help each other. Women helping women is some of the most powerful conversations that we have. Now, I am not a doctor, and although I'm a registered nurse, this is not medical advice. I advise that you always see your physician. But the issue here is that if you're having this problem, you may have already saw your physician and you may have sort of been blown off, or the treatment that you got may not have been effective, and they may not have been interested in exploring or giving you options until you found something that worked. What I want to tell you is that you are not alone. 50 to 80% of perimenopausal and postmenopausal women have this condition. But they say something like only 10 to 15% are adequately treated. We're going to talk about that. I would recommend, I'm going to have a link below in the comments on a book called My Menopausal Vagina. And I know that name is kind of out there, and sometimes we don't want to say things like that out there, but I am, because this is a book that's filled with humor and facts, and I found it to be very scientifically backed as well as humorous and really resonating and being relatable to all the things that I'm going through, as well as having great advice in there. And I think that it would be helpful to you to pick up that book. It would also be helpful to the men in your life who may be wondering about the intimacy part and why, is it them? That's always a question I think that they want to know, and it's not them. This is a real condition that affects so many women, perimenopausal and postmenopausal, but very few of us get adequate treatment. And what I want to tell you is that there is adequate treatment. Menopause is not avoidable, but this pain and discomfort associated with it is 100% avoidable. You have to go to your gynecologist and you have to insist, you have to be your own advocate and insist that they listen to you. Because once they prescribe something, it takes 3 to 4 months to work. It's not instant because it's actually rebuilding the tissue below. That tissue has thinned. It has gotten so thin that it is irritable. It's also dry. There's lack of blood flow. There's lack of estrogen. There's even some lack of testosterone. You'll have to read on that. Or in series 2, we'll get into that maybe a little bit more. You need to get started as soon as possible, and you need to stick with it. This is a treatment that you will need to take for the rest of your life. Now, in addition to prescription medications, there are also natural products that you can use, over-the-counter products that you can use, that either in adjunct or by themselves can be beneficial as well. But anything that you use is going to have to be repetitive. None of it's going to be a one and done treatment. If you've been to the doctor and you've been prescribed something, but it hasn't worked, you don't feel comfortable necessarily with your gynecologist, or you don't feel like they're listening, consider going to a urologist. This is not only a gynecological condition, this is a genitourinary condition as well. A lot of women who have vaginal atrophy also have frequent UTIs. That can be fatal. This is not something to brush off. This is not something to take lightly. And the fact that sometimes the healthcare community does that is an injustice to all women. But we can help each other out. Bring light to the subject, talk about it, put it out there, and arm yourselves with the knowledge that you're not alone and there is treatment, and that you just need to continue to fight for yourself. Go to a urologist. They seem to have maybe even more up-to-date information about the available treatments than for sure my gynecologist has. And there are options for you. There are vaginal rings that you can insert that release estrogen 24/7 and help you rebuild that tissue and ease your symptoms. There's also pills if you don't like the cream, like a tablet that can be inserted. There's also suppositories. There's also laser treatments that your insurance may cover even more than it covers the prescription medication. When you're using the cream, that is my favorite thing because it has completely helped me resolve my issues with a couple of the natural adjunct creams and treatments, because I can also put it over the surface area and massage it into that skin. So the irritation on the surface is treated as well as the tissues higher up in your urinary tract system, in your female system. You don't have to put a whole syringe generally. Follow your doctor's advice, but usually you can reduce that amount a little bit and just put like up to your first knuckles worth. Put it high up. It's not going to be too goopy if you do it that way, and then massage it into the tissues on the surface, and you can really over time rebuild that tissue and eliminate the pain. But there are choices if you don't like that. There are different brands, there are different price ranges. So also if something is too expensive, if these prescriptions are too expensive, which they often are in the United States, you can get a good RX card here, and you can look up where is the most cost-effective place to purchase it. And a lot of times, surprisingly enough, the cost that you pay with insurance is more than what you'd pay using GoodRx. So I would definitely check out GoodRx and ask your doctor about samples, ask your doctors about coupons. Go to the manufacturer and actually write a letter to them or email them asking if there's any coupons or any way that you can get it at a reduced cost. I've been able to do that, and it is very helpful in being able to afford this because, again, it's long term. There's also natural remedies like sea buckthorn oil, taking flaxseed oil. That was a suggestion from one of the ladies in the comments, as well as slippery elm. I like V Magic. It is a paste. I like to use that before intimacy so that there is absolutely no discomfort. The area is well lubricated and pain-free. There are options. We are going to get into a deeper dive on this subject. I have learned from you guys in the previous video that you don't care for long videos, so we're going to keep this a little on the short side, and then we're going to do a part 2 and a part 3. I encourage you to put your comments below so that I can answer them, so that other people can answer them, so that we can help each other. This shouldn't be a taboo subject because it affects a lot of us. And I think that these are the conversations that women have to have with each other, even if they're a little awkward at first. Between us all, we have the solutions. We know what needs to be done. We've all had our experiences. I also find that castor oil has been helpful, but this is not a castor oil video. This is a video about making sure that you advocate for yourself, letting you know that you're not alone, and that many women are suffering with the same thing, but that we don't have to. So this is just the first step into the discussion. Let me know what else you want to hear about this topic below, and I hope that this is a video that is relevant to you. Let me know what other topics you would like to hear about. We are going to explore lots of them. We are still going to get back to some makeup. I have some fun videos that are less serious than this coming up, but I thought this one was important, that we started the conversation. And that's what we're doing. We're starting the conversation. But there are more things to talk about. And we'll talk about some of those things in the upcoming videos. I hope that you're having a good day. I hope that this turned out to be a beautiful week for all of you. And I look forward to talking to you in the comments. I do have one other video out there where I'm thinking about changing the name of my channel to more fully encompass all of the aspects of women's health, not just beauty and not just skincare, but also the topics that we need to talk about to make the second half of our lives comfortable and as fulfilling as we possibly can. So I'd encourage you to look in the description, go to that link, watch that video, and give me your feedback there on what you think would be a good name for my new face of this channel, and see if your idea is chosen. You could win a $100 gift certificate of your choice, which will be announced on June 1st. You just need to be publicly subscribed to the channel. You just need to be over 18. This is not sponsored by YouTube. And until the next video, remember, happiness is a choice. Choose happiness today. Thank you so much for being here. See you in the next video.